And in countries, the last thing just to highlight, one of the things we repeatedly see in countries is when you have a supported, enabled, empowered community to carry out individual level measures where they know, where I know, what do I need to do, what does my family need to do, what does my community need to do, all of that contributes to reducing the spread. And that is something we cannot emphasize enough, because right now we need everyone everywhere to really support, to make sure that they don't get infected themselves and to make sure that they don't pass the virus to someone else should they either be infected or exposed. And so these are things that we need to continue to focus on, and we will continue to put these messages out day in and day out.
Thank you. I would like now to invite Gunilla von Hol to ask the next question. Gunilla, can you hear me?
Yes, I can.
Very well. Go ahead, please.
Thanks, Mariella, and thank you for taking my question. It concerns Sweden. Sweden has had a very different strategy from the rest of the world until now, until today, actually, when the government has introduced very, very tough restrictions. And it's basically the end of what's called the Swedish strategy. I'd like to hear what you think about this. Is this radical shift, is it a sign of a misunderstanding or misjudgment, or what has been needed really to stop the virus? And how useful can it be in this situation with a surge of cases to recommend the use of face masks in Sweden, which is basically the only country not recommending face masks? Thank you.
I think all countries have had to adapt to the realities of this wave of transmission of the virus. I think it was quite clear in the first months of the spread of this disease that while it had a major impact, the vast majority of people still remain susceptible to the virus, in most cases more than 90%. As the virus has spread again, particularly in the European region, and as people have suffered that fatigue of maintaining physical distance, wearing masks, hand washing, not attending crowds and gatherings, it is difficult. It's difficult for all to maintain discipline in that, self-managed discipline in that. The Swedish authorities had engaged and had, I believe, very high levels of compliance with their original measures back in the spring. And that social contract that exists in Sweden, the fact that the majority, I think over 50% of households in Sweden are single-person households. They did see issues in long-term care facilities amongst some immigrant populations who live in multi-generational homes, so it wasn't without its difficulties. I think this time round, Sweden has begun to implement and ask its population to do even more in terms of behavioural adaptation, and it has added into that some mandated measures. WHO's advice regarding mask wearing, I think, is quite clear. Masks work in particular environments where you can't maintain physical distance, where you're in a crowded setting. We would like people to look at all aspects of how you protect yourself, to look at your risk score, in a sense, on a weekly basis. You need to look at all of the activities in terms of the locations, the durations and the intensity of the contact you're going to have with people in those situations. There are many situations where wearing a mask is a very good addition to all of the other measures, maintaining physical distance and washing hands, avoiding crowded places, and in particular linking the hand sanitisation and hand washing to mask use as well. It's really important that people wear masks properly, use the right kind of masks, but also wear masks properly fitted on their face and not under their nose, and also take care that when you're applying the mask and taking off the mask, you're using your hands, and therefore that should always be done with proper regard for sanitisation. So we would advise all countries in situations of widespread community transmission to consider the utilisation of masks in those specific contexts where transmission risk is high. I'll pass to Maria for the specifics on that. But again, with regard, it's easy in all of these situations. Countries are on a journey, and countries are trying to use the data as best they can to protect their populations. These decisions are made in good faith. They are evidence-based, and they represent the considered view of people who advise on policy. adjusting and shifting and changing those policies is not a weakness, that's a strength. It takes courage sometimes to move away from a path and recognise that you have to add additional measures. That's not a failure, that's a sign that the system is capable of listening, adapting and adjusting to new realities that you didn't expect to be the case. So this is not a time, I believe, for recrimination. This is a time for solidarity, of moving forward together, finding the right combination of measures that works, and then implementing it in a consistent and fair fashion with the least recrimination possible, maintaining unity, if at all possible, between all sectors of society and government. Maria?
Okay, thank you, Dr. Ryan. I would like now to invite RFI, Jeremy Lange from Radio France Internationale to ask the next question. Jeremy, can you hear me?
Yes, I can hear you, Fadila. Can you hear me?
Yeah, very well. Go ahead, please.
Thanks a lot. A question. I would like to know what is the dominant feeling right now at WHO? Are you more amazed by the results of Moderna, Pfizer, and the likes? Or are you more worried that those vaccines, if proven effective, will only be available in rich countries? Thanks.
Merci, Jeremy. Dr. Simao?
Let me start, and then Dr. Soumya can complement. Of course, we are very happy to hear positive results, but there are many vaccine candidates coming up with results before the end of this year and beginning of next year. And some will be easier to implement at country level, and some will be more challenging. But overall, we see the landscape as very, very promising so far. And the fact that we have already 2 vaccine candidates that are showing interim results at 94.5 efficacy results, it's quite encouraging. Of course, as I mentioned, there are challenges in the implementation, but we are also aiming through the COVAX facility in ensuring that countries will have a chance opportunity to have access to the vaccines they prefer in due time, and that we don't have a long lagging period between these vaccines reaching developing countries and developed countries. Soumya, I don't know if you want to complement.
Dr. Swaminathan?
I think
Go ahead, please.
Mary Angela has answered the question. And we remain optimistic, and we would like to work with all manufacturers and developers with the COVAX facility to ensure that we have the widest possible selection of candidates available, because some candidates will suit more in certain situations, perhaps in certain subgroups like the elderly. Some will have different storage conditions, and so on. So it would be good to really have a portfolio of products so that countries can also have some choice in the matter. But I think we're looking at least the first half of next year as being a period of very, very limited doses. Supplies are going to be limited. There are bilateral deals that many of the companies have done. So many of the doses have already been booked by some countries. We are hoping that there will be enough in the facility so that the AMC countries, the 92 countries in the AMC group, will also get access to these doses at the same time. But right now, it's just a question of planning week by week and day by day. But our goal is to ensure that the highest risk people in all countries, Dr. Tedros mentioned the health workers who are under tremendous strain and who are also being disproportionately affected by this pandemic. We want to make sure that these frontline workers, regardless of which country they're in, are protected. And that's our goal, and we're trying to work with all countries to see that this happens. But this, again, as Dr. Tedros had said many times, this requires global solidarity to really ensure that we achieve the goal of equitable access. Over.
Dr. Ryan, please.
Yeah, I think it's good for us to reflect on the amazing journey that we've all been on in terms of global science, and to reflect on the fact that before this pandemic started, as part of the research and development blueprint, we had target product profiles for coronavirus vaccines, for disease X, for therapeutics, and the world and many scientists had come together to agree on what we would need to be doing really quickly in the face of a pandemic. That transformed in February, within a few days of Dr. Tedros declaring the highest level of global alert, into a research and development roadmap, which was the result of hundreds of scientists coming together under the leadership of people like Sumia and Mariangela, Maria, and so many others in the R&D who support the R&D blueprint. That roadmap then was used as a blueprint to bring together technical partners. Dr. Tedros has been working at the political level on this issue since March, since April, talking to global leaders going way, way back, trying to build an alliance and a coalition between multilateral organizations and powerful member states to create the momentum that could drive this forward. But we are at that moment of great hope, but we need to hope with attitude. We need to hope with determination, with planning, with investment, with financing, with implementation, with readiness, the issues that Kate mentioned about getting countries ready to be able to deliver this vaccine to those who will benefit from it, and ensuring that's done with equity. So yes, it is a moment of great hope, and it is a moment that demonstrates what human civilization and what science can deliver when it works across ideologic and country boundaries, when it works towards a common good, a common goal, a global good. And when we see that happening, we should take hope from that. Science, solidarity and solutions, as Tedros has said almost every day at these press conferences, and he says it every day to us, that's what we have to focus on. And I think we should have hope. We should have realistic hope that we're not there yet, and a testament to everyone in COVAX and everyone in the R&D blueprint, everybody who supports the work that Mariangela is doing, leading on allocation, on equitable allocation. We're not there yet, but I certainly would strike a note of hope in this regard.
Thank you all. I think Dr. Adkili would like to add something.
Just really briefly on Mike's point that we're not there yet, but we're getting there. I mean, I think these points that we've raised earlier about the measures that need to be taken continue to take now and will be needed even after the vaccine is introduced. Last week we had 60,000 deaths. We had 4 million new cases. We'll have more of those weeks before the vaccine is out there. And I think I'm sure my partner Kate would mention what also Sumia and Mariangela mentioned. It's not vaccines that save people, it's vaccinations that will actually save people. So the delivery function and the work on the ACT Accelerator is an important piece of that. We have spent recently work over the past 2 weeks plus to really integrate the work of the vaccines pillar of the ACT Accelerator with the health systems strengthening work that's there, working with the ACT Accelerator partners as well as with the World Bank, and really focusing on ramping up delivery in 100 countries over the next 100 days to really look at how we can accelerate readiness. And I think that piece is going to be key.
Thank you. I would like also to ask Dr. Kate O'Brien, who has something to add. Dr. O'Brien?
Yeah, I really want to emphasize the great excitement there is, not only at WHO, but I'm sure around the world with the results that are coming out now from 2 phase 3 clinical efficacy trials. The part I really want to emphasize is we have plenty of vaccines that are life-saving vaccines. Measles is an example of that, a highly efficacious vaccine, over 95% efficacy, and yet we still have measles outbreaks. And so the importance of having achieved, if obviously the data need to be reviewed by regulators and a full analysis of the data needs to be taken, and these trials need to be completed, as Sumia has emphasized. But this is, there was a really nice analogy recently about getting to vaccine efficacy is like building base camp at Everest. But the climb to the peak is really about delivering the vaccines. And this cannot be overemphasized, that the people who need to receive these vaccines are the ones who really are the focus now. as we start to see that we have vaccines that may in fact really have very strong efficacy. So the work is really beginning. For immunization of adults in many, many countries around the world. So this is really going to have to lean on the programs for immunization that we have in every country around the world, but they have largely focused on infants, children, and adolescents. So there's an enormous amount of work to do and resources that will be needed to actually deliver the vaccines to everybody who needs these vaccines, should they in fact come forward as some of these press releases indicate they should.
Thank you all. I would like to give the floor to Tomo from Kyoto. Tomo, can you hear me?
Yes, can you hear me, Fatila?
Very well. Go ahead, please.
Thank you. Dr. Tedros, congratulations that you're back in the actual podium, not the virtual, on this press conference. So you have finally tested negative on the coronavirus. And another question, if I may, to Dr. Van Kerkhoff. We see the reports of Associated Press that there's a cluster of infections going on in WHO. Could you clarify about how many cases in WHO headquarters and how serious the situation is? Thank you.
I will thank you, Tomo, for the question. It's nice to hear your voice again. So yes, we are, as you know, as all workplaces, we are following infections, and we're monitoring the health of all of our staff all over the world. We have had cases that have been staff members, and yes, I did also see the AP story. There have been 65 cases associated with HQ staff, headquarters staff, not all of which have been on the premises. There have been 36. Those 65 are from the start of the pandemic. So let us be very clear on that. And clearly, the AP is reporting on an email that was sent to staff about that. So those are 65 cases reported since the beginning of the year. 36 have had access to the premises, who have been on the premises. As I'm sure you know, we've greatly reduced our staff in the building. We're working in these different types of phases depending on the epidemiologic situation in the areas that are around us, as most workplaces are doing. And we have had some cases that have been associated with the premises. We do have some cases in the last week that are linked together. We don't know if they're an actual cluster. So what we do is, when we have any cases, is we first make sure that they have access to a test, make sure that they have access to appropriate care. All are doing well. All have mild disease or asymptomatic. And we are tracing back, and we're also tracing forward. So what we do is we carry out contact tracing to see who they came in contact with, to see if there are any further onward transmission, as most countries are doing. But we also look back to see what did they do in the previous 14 days, for example. And so we do have cases that are linked within a team, but there are possible ways in which they were infected outside of the premises. So we're still doing the epidemiologic investigation with that, with these individuals, but they are all doing well. And just for your information, we have initiated a number of practices in the building, again, as all workplaces have, with our physical distancing, with the use of masks when we can't physical distance, making sure our ventilation is appropriate, making sure that we reduce the footprint on the campus, we limit our in-person meetings. We have utilized a lot of the different online platforms to have our meetings so that we continue to do the work that we do. We have tape on the floor that help us, where it's appropriate to sit, to make sure that we keep our spacing. So we are constantly looking at the measures that we have in place. We adjust them as necessary, and we will continue to do so. So thank you very much for the question and the concern for our staff.
Yeah, I think it's also important to clarify that Maria, myself, Tedros, or anyone at this table, we don't control the contact tracing or other processes in-house. We don't get to say who stays or who goes. Dr. Tedros has stayed home, not because I told him or he told himself, but because our contact tracing teams made that decision. We have a special working group made up of key experts around the House. They meet, they decide, they investigate, they apply